All right, let's get started. Good afternoon, everyone. Tonight's program will be recorded and uploaded to the EMSS AAEM website within about 48 hours. If you're in the audience, feel free to say hello. You know, tell us where you're from in the chat. We'd love to hear from you. If you have questions, feel free to raise your hand. We'll call on you, or if you want to put it in the chat, we'll save it to the end, and I'll bring it up to the presenters at the end when we have a Q&A session. They're meant to be interactive, which is why we chose it to be in a Zoom meeting, not a strict webinar format. We want you to be engaged. If you have comments, please feel free to reach out, either chat or just raise a hand. So, this is an interesting topic. This is something new and different. So I am going to stop sharing my screen, and I have the privilege of introducing the speakers tonight. We have Dr. Jacob Miller. He's a primary care sports medicine physician with the Intermountain Health Rocky Mountain Orthopedics in Grand Junction, Colorado, where he's associate professor of family medicine at the University of South Dakota at Stanford School of Medicine. He competed in calf roping and team roping in high school and college in Colorado State U, and completed medical school at Creighton University in Omaha, Nebraska, and did family medicine residency in North Colorado Medical Center, and did primary care sports medicine fellowship at the University of Utah. He practiced for 8 years with Sanford Health in Aberdeen, and has served as head team physician for Northern State University, where he has organized medical coverage for the local Dakota Bank Rodeo. And along with him, we have Dr. Michelle Hollis, who is a fellow of AAEM and the American Medical Society for Sports Medicine. She is a private practice, a physician specializing in the needs of the equestrian athlete. After 20 years of hospital-based traditional EM working as an independent contractor, she's now based in Wellington, Florida during the winter season, providing medical services to her clients based across the country during the rest of the year. She's the chair of the U.S. Hunter Jumper Association Safety Committee and the medical director of the newly formed Equestrian Health and Safety Foundation. She's dedicated to advocacy, education, and research in the equestrian sports medicine arena. So welcome, Dr. Hollis and Dr. Miller. Please come on screen, introduce yourself, say hello, unmute your microphones, and let's talk about the equestrian athlete.
Thank you, Scott. So we're going to talk with you about equestrian event coverage, and neither of us have any disclosures. So we'll move on to the objectives. So Jake is a family medicine doc and I'm an EM doc. How did this happen? We met at a sports medicine conference for SSM and connected over our interest in event coverage for horse sports. In spite of the differences in Western sport, which is where he comes from, and an English type competition where I come from, we saw that there were some similar challenges. And we want to help you, number one, appreciate the mechanism of injury by sort of explaining the background of the sports. Two, help you understand the perspective of both the show management that's putting on the competition and the competitors that are competing in the competition. And most importantly, we want to help you identify some strategies to work with the event staff in order to optimize emergency response in the event of an untoward incident, particularly for those of you who may be functioning as OMDs and may have pre-hospital personnel that you oversee. So with that, Jake is going to introduce you to rodeo.
Dr. Miller, you might be on mute. So while Dr. Miller is figuring this out and maybe on mute, does anyone have any questions for Dr. Hollis? If you want to put it in the chat or you want to just ask. Dr. Miller, you ready to go?
Yes, can you hear me now?
Yeah.
Sorry about that. Thank you very much, Dr. Hollis, and I appreciate Dr. Goldstein's introduction. We're very thankful to the AAEM for allowing us to share this presentation, which is very special to Dr. Hollis and I. I'm grateful to have the opportunity to introduce you to the sport of rodeo. For those who are not acquainted with it, this sport has been in my family's blood and my blood for a long time. I consider it the great American sport, even though it wasn't invented here. It was actually started back in Spain in the late 1700s and early 1800s with the vaqueros who lived there. When they brought their ranching activities out to the United States, we perfected it at that point, and now it's ours, and we're very happy to have it. The sport of rodeo came from those ranching activities in the American West, and rodeo consists of thousands of independent events that occur throughout our country each year, ranging from the youth to professional ranks. It is a loose conglomeration of events.
Dr. Miller, did you want to share your screen of your PowerPoint? It's not being shared.
I'm very sorry.
There we go. There we go.
There we go. All right.
Perfect.
There's not a set program for rodeo. Most rodeos will have the core 7 events of tie-down roping, team roping, barrel racing, steer wrestling, bareback riding, saddle bronc riding, and bull riding. But they can also have a somewhat eclectic mix of other events. Some will have breakaway roping, but others will also include events such as the wild cow milking or the wild horse racing, which introduce various levels of risk to these events. Once again, the organization of each rodeo is independent. Each rodeo committee instills their own kind of program for the rodeo with only loose sanctioning by the Professional Rodeo Cowboys Association, which is the largest professional cowboy association in the country.
Okay, so flipping the coin to English style competition, the U.S. Equestrian Federation is the leading authority for the majority of English style competition and is the national governing body for Olympic equestrian sport. The 4 disciplines that are found in the Olympics are 3D eventing, show jumping, dressage, and para equestrian. My experience, for the most part, deals with the show jumping event coverage, but you can see that there are a number of things that fall under the umbrella. A lot of different breeds. Some national disciplines go along with the international disciplines as well. Next slide. So jumping right into where the accidents happen, the risk is going to vary by type of competition. You may have a dressage competition where the horses are performing dance movements as commanded by the rider, where they're just working on a flat level surface. There aren't any jumps. You might have a competition where there are jumps, where they're moving at speed. There may be a competition where there are jumps and they're moving slowly. So the type of competition matters. You may have competitions where there are multiple show rings going on at one time, which means there are multiple areas where something could go wrong. You may have competitions where the events are taking place on an open space where there are no defined boundaries or rings or fences, as with 3D eventing. There may be just the flat work where they're not jumping over jumps, as you see in the picture with the dressage, and they could either be events where the horses are moving quickly and judged on how fast they complete the pattern, or they may be judged on whether they're completing the movements in a nice way, like you would expect. With the difference between ice and ice skating, you have ice dancing and you have speed skating. It's a similar difference in types of competition. Next slide. So when you look at this one, this is an example of show jumping. That is a 1.50-meter jump. So if you were to walk out of the ring and walk up next to that jump, those poles at the top, pretty much at your head. So the horse is jumping over that. And so you can imagine a fall at this height can be a significant fall. For the most part, riders who've been competing for a long time have a good idea about how to fall. But sometimes you can't choose the way that happens. So the height of the jumps can be an issue, and the speed at which they're traveling. This is what it looks like for Olympic level competition, and these folks are trying to go as fast as they can over the jumps in order to beat the clock and be faster than the other competitors. So you can imagine that goes pretty fast. Next slide. And this is an example of a cross-country obstacle for 3-day eventing. And you can see that obstacle is pretty solid and it is not going to collapse under the rider, where in the show jumping picture previously, that jump just falls apart. This one is very solid. And if you hit that at speed, then you can have a rotational fall with the horse, the rider, and you can imagine what sort of injuries you can have with that. Next slide.
So as we've seen, equestrian events require a close partnership between the horse and rider. I think this slide can best be summarized by saying that horses are big, fast, strong animals. And all of the inherent injury risk that goes along with each of those adjectives brings to bear injury risk upon the rider at that point. Horses also don't think like us. They have their own agenda. Most of the time it falls in line with what the rider's is, but sometimes it doesn't. And that also increases injury risk. One other thing that increases injury risk within these kinds of sports is that there are minimal safety guidelines or requirements for various types of safety equipment or protection. And when there is recommendations as far as what kinds of safety equipment the riders should use, oftentimes it's not followed. A 2014 study found that only about 20% of people who rode horses use some kind of helmet, which would of course decrease head injuries in that population. And so all of these things increase the injury risk for the athletes and patients that we're talking about here. This study by Havlik in 2010 outlined slightly better some of the demographics for the patients that we're seeing who get injured during equestrian events. They found that about 20% will suffer some kind of injury that requires medical care and hospitalization during their riding careers. About 40% of these injuries will take place within youth, which underscores that being new to the sport or not being very strong to control these strong animals does increase injury risk and have an impact. I also found that horseback riding is responsible for about 1/4 of all lethal sports injuries yearly, and the third most common cause of sport-related concussion in adults. This 2008 study by Loader also strives to help us understand what kinds of injuries that we are likely to see within this population. This study looked at over 5,000 ER visits between 2002 and 2004 and identified 66% of women patients were studied. About 36% of these kinds of injuries occur within the confines of the home or the local arena. Almost 60% reported that they fell from their horse as their mechanism, although I think that this study likely reviewed the ER reports rather than what the patient would have said, because I don't know that I would find many horseback riders who would admit they fell off their horse. Most would say they got bucked off or thrown off or something else happened. But at any rate, the most common type of injury was bruises or abrasions. The upper extremity was the most common site of injury, with the trunk not too far behind, excuse me. And the most commonly fractured site was the forearm. Once again, noting that many of these injuries occur within youth, most of the injuries occurred within the second and fifth decades of life.
So for the purposes of competition, and specifically in competition, the types of injuries that we'd see that you might be responding to are TBI, ranging from minor concussion type symptoms to skull fracture with intracranial hemorrhage. Regarding spinal cord injury, the cervical spine is most often affected due to mechanism of fall. For extremity injuries, we see fall and outstretched hand, shoulder dislocations, ankle sprains, tib hip fractures, and femur fractures. Chest injuries, clavicle fractures are pretty common, as are rib fractures. Just about anything that you can imagine that would result from a fall from height, you're going to see as far as the injury spectrum. Next slide. So what sort of safety requirements are there in place for the world of equestrian horse show management? As far as the USEF is concerned, they require an emergency action plan. It doesn't have to have a whole lot of detail, but it requires a protocol for calling 911 and the radio protocols to be used by the staff there. Emergency telephone numbers and directions to hospitals from the competition, and the name and contact information of a safety coordinator. Those are three basic things that are required to be a part of the preparedness plan. They're required to have a safety coordinator, but only for 3-day eventing is a safety coordinator not allowed to have any other duties. So the person who is the safety coordinator may be the horse show manager, maybe head of security, maybe someone who's running a ring. They may have other duties. So that safety coordinator may not just be the safety coordinator. Next slide. The additional requirements of the horse show management are to provide qualified medical personnel on site. So the different levels of competition and different types of competition may or may not require a paramedic, but they do have to have someone with some basic pre-hospital trauma training. Again, 3-day eventing type competitions do require that there is a paramedic on site in order for the competition to occur. Ambulance is not required to be on site. They may be on competition grounds, or they may simply just be available as a 911 call. The issue that many horse show management companies find with the ambulance being stationed on site is if the ambulance leaves with the patient, then the show has to wait until the ambulance comes back. So typically, what happens for most competitions is that they have personnel there to essentially treat the patient for the first few minutes until an ambulance arrives to transport. Next slide. From the participant side, the requirements as far as USEF is concerned is that they must wear protective headgear that meet an ASTM standard, which means they have to wear a helmet. And that was a long fought issue for the English riding community for many years. But it is required, and there's certain headgear requirements that they have to meet from the ASTM standard. Also, if a person appears concussed, then they have to seek evaluation before returning to competition. So you may see folks in the emergency department with a form from USEF that says, can I get back on my horse? And they all want to get back on their horse as quickly as possible. And next slide. So 2 other items of apparel that you may see. One is a safety vest. It's made of hard compressed foam, and it is a required garment for 3-day eventing, not for other disciplines. It's been determined to be a safe adjunct. It's good for protecting the ribs and the thorax, and that's pretty much the extent of it. There's another garment of apparel that we see called an air vest, which is attached to the saddle by that ripcord that you can see there dangling from the right side of the garment. Deploys when it's separated from the saddle, makes a loud pop, and results in inflation like a life preserver, basically. For a 3-day competition, it is optional to be worn over the safety vest, but it cannot be used as a standalone. In other competitions, sometimes you'll see that as a standalone. In show jumping competition, you frequently see that as a standalone. The jury's still out on whether or not that actually improves your chances of being uninjured or increases your chances of being uninjured based on the mechanism of the fall. An axial loading injury, that tends to stiffen the thorax, which leaves the neck less protected. So with that as the least, I guess the most flexible point, then sometimes we'll see some increased incidence of spinal cord injury. So those are just a couple of the items that you might see as far as the safety apparel is concerned. Next slide.
So if you're considering dipping your toe into the arena, like this horse is, just remember that many equestrian events take the standpoint of you ride at your own risk. And I like this quote from this 2010 study, which says, if serious injury is a likely result of exposure to horses, then the centuries of horse management, training, and education to date appear to have done little to prevent injuries to human beings in their interaction with equids. So you might ask, well, if we have these big, strong animals, they're very fast, they don't always have our best interests at heart, what might be the safety requirements for the rodeo athlete? And the answer to that is not much, to be honest with you. Like we say, the Professional Rodeo Cowboys Association, which oversees and sanctions many rodeos, is a sanctioning body only. They do not have the oversight granted to them at this time to mandate medical coverage. They don't provide clearance, medical clearance requirements. They also don't require safety equipment of any kind. They strongly encourage certain things, but they don't have the authority to mandate those kinds of things. Within the last 30 years, the Justin Boot Company has started to exert some influence within the rodeo sports medicine world, and they've established the Cowboy Crisis Fund, which gives donated money to rodeo cowboys and cowgirls who are injured during competition or practice, which helps offset some medical costs. They also do provide, with many rodeos, a Justin Sports Medicine trailer, which has the presence of several athletic trainers or other medical personnel that are there to help cover the rodeo. So there's that kind of help, but there's no medical oversight or overarching medical governance from the PRCA. Little Britches Rodeo, which is probably the largest youth rodeo association in the country, does require that 2 EMTs must be present at each event. When you read through their bylaws, however, most of their safety requirements or encouragements really go down to, is the scene safe? Do we have good groundskeepers? Do we have safe fencing around the area so that we're not introducing risk to our athletes? But won't see very little medical governance. And I should also say that within most rodeo environments, the medical coverage there, regardless of how well-intentioned they are, will probably not have a recognized medical authority to disqualify an athlete from competition. I have one example where when I was covering a rodeo, there was a steer wrestler who was obviously knocked out during the run, was unconscious in the arena. He revived on his own, was able to stand up with some assistance, but was tottering back and forth, was clearly dizzy, did not have good equilibrium. So he was brought over to the ambulance where he was evaluated. And I told him that your day is done. You have a concussion. We would encourage you to go home. It's a hot day. It's the 4th of July rodeo. So I'd encourage you to stay well hydrated. These are the risk protocols as far as what we'd want you to watch for. And we'd encourage you to follow up with your primary care doctor to see how the concussion is progressing within this next week. And they thanked me kindly, he and his parents, and they walked off. 15 minutes later, he was up in the team roping, had a really nice run, but obviously they did not recognize there was any medical authority at that rodeo. That can be frustrating, but that's unfortunately the nature of that sport right now. It's also one of the culture characteristics of rodeo at this point, and something to be considered when you're covering.
So what does the horse show need to know? The horse show needs your help. They need to know what the local EMS protocols are for the given facility in the area where they're located. They will not be aware likely of what sort of protocols are required to have air transport versus ground transport. The ambulance service in the area, is it mostly private services like EMR or county municipal services? They're going to probably be looking for pre-hospital personnel to work at their horse shows. So they would like to be able to find a pool of ready paramedics or EMTs that they can hire to work as their safety personnel or their qualified medical personnel. They also need to know what the local hospital capabilities are. They need to know how far they are from a trauma center, what hospitals can they suggest for people who leave to go seek care on their own that don't require EMS transport. Next slide. So why is emergency response difficult? Horse people are like horses, and horses are flight animals. So horse people tend to not want to seek medical care for the same reasons that Jake has already outlined. They just want to get back on their horse. They're not really interested in any of the competition. That's common to a lot of sports, but I think specific particularly to horse people. On scene at an event, the paths are blocked often by structure, and it's really not taken into account the idea that a hospital, that an ambulance may need to make ingress or egress from the facility. And horse people are resistant to getting treatment. The horse comes first. They're worried about the horse. They're generally not too concerned about themselves. Next slide.
I'm seeing some very good comments in the chat. Looks like some folks from San Antonio and Denver who have some experience covering rodeos. This may be your scene. This is the Apache Junction Rodeo in Arizona. And in many cases, you will have an equestrian event in this kind of an environment. You have a large arena with a large grandstand. You can see in the background, there's probably a carnival going on there in the background, or maybe a fair. All of the contestants have their trailers and trucks parked all around. There are many contestants that are walking around the arena grounds and kind of watching the events. And it's important to consider, how would I get my ambulance in here? How would I access parts of this arena? How would I access parts out of the arena? There's probably some kind of a warm-up area that's on the same grounds that also falls under the purview of the medical team. And so recognizing the just the barriers that exist. And this is a rural environment, but as in San Antonio or Denver or Madison Square Garden or Los Angeles, there are some other rodeos that take place in very urban areas. And that poses a whole new set of challenges for getting your team there and extricating your injured athletes from that location. To emphasize some of the things that Dr. Hollis has already said, these environments can be very congested. They can be very loud. Usually there's an announcer telling jokes along with the clown, and so it's hard to communicate sometimes. And it's a dangerous competition venue. You have dirt, sometimes clay, sometimes grass that you're competing on. Much of the fencing around is metal. It's not very forgiving. And you have a lot of people there who are watching what's going on as well. As Dr. Hollis alluded to, there's sometimes a culture clash that occurs between the medical team and the athletes that you're working with. Rodeo especially has a history of being focused on the independence of the athlete and the sport. And there hasn't been a lot of strong relationships with medical care throughout its existence. And so sometimes you have some distrust or mistrust. Sometimes you just don't really understand what the medical team can offer you at that point. And so there's some inroads that need to be made there. Likewise, many of the medical team may not have any acquaintance with equestrian events. And so getting to understand your athletes is very important, and how to help them understand that we can be beneficial in these environments and that they may need to seek care. There's also a very wide variability in care environment, like we just talked about. This may be an urban area. This may be a very rural area with not many resources. No two rodeos are the same. You're going to have different parameters of the arena, the ingress and egress areas, and what kinds of familiarity that team has with you.
So how can we help each other? If you get wind of there's going to be a horse show or a rodeo in an area where you are connected with the EMS system, you might reach out to the horse show manager and ask if there's any, if they need any help. They could use some advice about any local protocols that would be very helpful as they're planning, as they plan their emergency action plan. If you're involved with an EMS agency in an area where there is a facility that has a horse show going on, often these are multi-day affairs. So maybe just daily reminders to the EMS personnel at shift change that there's a horse show going on. If you're on scene, you want to make sure that you are performing situational awareness such that you know that horses don't respond well to loud noises. You may have to cut the lights and sirens. Know that it can be difficult to move about the facility. So it's important to have a plan in place prior to the event where you can have a handoff point that makes it easy for you to get in and out of the showgrounds. And it's nice to come by on the day before the show starts to just do a walkabout and look at where things are, where the competition's going to be, where the likely areas where injuries would occur. Super helpful. And just sort of make friends with the medical team that's going to be there. You'll get a sense of what level of training do these qualified medical personnel have. That's always good to know who you can trust and who you may have to really keep an eye on better. And come watch the show, come hang out. As we know in emergency medicine, being prepared sometimes keeps the evil spirits away. It's the horse show that has someone already there on the showgrounds that tends to not have something bad happen. So never a bad idea to just pop by and say hi if you're in the area. Next slide.
Someone had a question about how, Dr. Miller, how, you told the person to go home and he opted to go back and participate again. How does your liability work? Do you AMA them? Do you just document, or is there even documentation?
Sure. What I did in that particular situation is I did document. I just kind of created a chart for that patient once I got back to my own EHR and just kind of explained what had happened and the advice the patient was given. What I would say is that this situation was interesting because they did not refuse my care or my recommendations. In fact, they said, yes, that sounds very good. We'll do that. And then they left and they changed their minds. And so they didn't dispute what I was telling them, but that was that situation. I think that if you're in that kind of situation where the athlete is refusing to stop participating, we'll get to this in just a moment. You have a couple of different recourses that you could consider. So I'll answer that more fully here in just a moment. But certainly documenting what is done, documenting what the exam was like, what the circumstances were like, all that can be done very well. And it doesn't have to be real formal, but as long as you have some kind of record of what your assessment was and what recommendations you gave, I think that's important. We were talking before I came on here. Right now, I'm working on getting medical liability to cover rodeos here locally in Colorado. I just changed jobs, and I think that's one of the considerations they have is just to understand that yes, your liability will cover you. In some cases, there's good Samaritan laws that apply, but I think it's good to have the backing of your organization if you're going to be going and covering these things.
Yeah, and just piggybacking onto what Jake said, some of these events, if you're there as a good Samaritan, that's pretty much all you have. You don't really have any authority to make someone go or not go. Often these are not paid situations. It may just be a parent of a child if it's a smaller horse show, a small local show. There's a wide range of competition in terms of level of competition, from professional to peewee type situations.
So are you not documenting every interaction or just the ones that you're concerned about?
It depends on the competition and what your relationship is with the competition. So if you're there functioning as a physician, if you're if you're the qualified medical personnel that's with USEF, if you're the qualified medical personnel that's the paid staff there, then yes, you would be documenting the interactions. But there aren't a lot of formalized paperwork across the board for those competitions. It's pretty much individually what the competition decides to use. So this is an area that could use a lot of support from folks who do specialize in event medicine and particularly in EMS and event medicine. So hopefully we could do some collaborating, ideally.
Yes, I would second Dr. Hollis on that. I think that in some situations you consider this similar to covering the high school football game, that you're not documenting every time you tape someone up or every Band-Aid that you give. But if there's meaningful interaction that requires follow-up, generally you're documenting those kinds of interactions. Great questions. Other questions? Okay.
Not right now. I've been asking them as they've been coming up.
Okay, great. Very good. So just to talk about coverage of the event, this is a protocol or recommendations that were published in May 2010 by Young and Markey, just talking about what to consider when you are doing rodeo event coverage. And like I mentioned previously, access to the arena is really, really important. You want to make sure that you're positioning your people where they can get in and get out quickly and as easily as they can. Staging areas are also recommended. These are places where you position members of your team so that they can do more thorough assessments of injured athletes when they come out of the arena. Most of the time, this is behind the bucking chutes or behind the roping boxes where they do the timed events. It's also really important to understand your local resources. What kinds of things you're going to be able to do there at the arena, what kinds of things need EMS help, and what kinds of things need to go to the hospital. And once they get to the hospital, what kinds of support do you have there? Do you have neurotrauma? Do you have neurosurgery? High-end orthopedic trauma surgery? Do you have sports medicine, internal medicine? Those are all things to consider and to map out when you're forming your EAP for these events. This last bullet is mine. I think it's really important, like we talked about, to try to help the rodeo athletes understand that you're there to help, and the rest of the team that's there to put on the rodeo. So there's three people that I always introduce myself when I get there. One's the announcer. I usually hand him a business card and say, hey, can you give us a shout out during the rodeo? One, that helps people know that you're there. And two, that helps the production team understand that medical support is there should the need arise. Always introduce yourself to the EMT or paramedics. Let them know that you're there to handle things that may not require emergency levels of care, or to support and triage things that may need their care. And the third and probably most important one would be the stock contractor. Now, the stock contractor is the guy that owns the cattle and the horses that are there for the event. He has the ear of the rodeo production team. He has the respect of the athletes. And if anything happens that requires kind of a boss of the arena to do, that's not really him. This is the one to whom I would appeal should you say you have an athlete who really is injured and really shouldn't go back, but is being hard-headed or wants to go back pretty badly. The stock contractor is the one to go and appeal to and say, I really don't think it's safe for this athlete to compete. And then they have the credibility and the wherewithal, the authority to turn out that athlete to say, no, you're not going to get on this horse. One, because it's not safe for you, and two, because it's not safe for my stock. So your stock contractor is a very important person to know at the rodeo. I do want to share something about event coverage in terms of lines of talking. You definitely want to be able to communicate with your team using a walkie-talkie, WhatsApp, or your cell phone. Your care teams can be as varied as you choose, or whoever wants to be there. I do have to say that most rodeos that I've covered, I've been the only one there. But working with some larger teams really gives excellent care, where you have an athletic trainer, your physical therapist, massage therapist, a chiropractor, your orthopedic surgeon who gets to be there to do his assessment as well. And you should ideally have at least two groups on standby at the arena, one on one side and one at the other. This picture off to the right is me and my PA colleague. We're watching the breakaway roping in the small arena while action goes on the left-hand side within the large arena as well. And of course, you want to have the medical coordinator who is overseeing your big picture items. It's important to remember, though, that you also have some help from other first responders at the rodeo. And I'd like to share something with you. This is not an equestrian event. This is a bovine event, actually. So I'm going to switch screens here for just a moment. And this is a pro bullfighting event from an athlete named Cade Gibson. And this event was in my hometown. And what I want you to watch is who else comes out to help when Cade gets hurt. Kind of watch who the people are who are gathering around him and what's happening in the arena. Is everyone able to see?
Yes.
All right. So at this point, Cade is out in the arena. Notice who else is out there with him. These are all his fellow competitors, all the fellow bullfighters. They recognize that their friend is in trouble And they're all doing their part to keep that bull as far away as they can. They've also got some shoot help. You see the guy on the horse over there, that's the pickup man. He's going to come in and he also tries to clear the arena on horseback. But it's going to be all hands on deck for the competitors and for the other shoot help to try and clear the arena so it's safe for the downed athlete. And as you can see, sometimes it's not easy. Looking on your left-hand side, notice one guy has taken the position of standing at Cade's head. He's going to stay there, and he's going to protect his body while that bull's in the arena so that he doesn't get hurt worse.
Just hang in. Once we get him out of here, we'll get a medical personnel inside the arena.
And it remains challenging. You can see how sometimes it takes a little while to try to convince the bull to come out. And even gets a little bit hairy.
Dude is going to get that bull out.
They're able to get the bull out of the arena finally. And now you see this man, the teal shirt comes out, and then through the gate there, you see our EMS crew start to come out. So now the scene is safe and our crews can start to do what they need to do. We'll come back to our slideshow here for just a moment.
Busted. 30-year-old man in a single car MD.
All right. So just like any other search and rescue kind of operation, the first thing that happens within these events is scene safety. We want to make sure that we're not putting our athletes at higher risk, or our event management or the EMS or medical teams. When we get out there, we're performing a rapid primary survey to assess what kind of care this athlete might need. At that point, we are sometimes doing a scoop and run, where it's just getting that athlete out of the arena so that they can get to a higher level of care. Or if they're able to get off under their own power, they can be helped off there and then move to a staging area for a more thorough evaluation. Unfortunately, these kinds of injuries don't happen just within the dirt of the arena. Sometimes they happen within the chutes. And these can be dangerous places because they're very congested, they're close. You're in there with a wild animal, and there's a lot of metal around. And so when injuries happen, they tend to be rather traumatic. This image shows that the horse has fallen backwards within the chute and is actually pinning this cowboy between the horse and the chute itself. Extrication during these areas can be kind of difficult. Generally, we're using a smaller backboard, such as a Kendrick or some other smaller means. And then this is one other area where your stock contractor can really come in handy. They know their animals. They know what kinds of help and resources that they have around, so they can help to quiet the animal. They can move some of the equipment around if they need to. They can be a great resource in this area.
Any other questions we have?
Actually, yeah, I do have one question if you can hear me.
Yeah, go ahead, Dr. Cooley.
Yeah, Craig Cooley out of San Antonio, or EMS Fellowship. Sorry, I'm driving, so I'm not really visual. It was mentioned earlier on, I think, with the non-rodeo style events, that often will use either EMTs or paramedics. Under whose medical authority are they operating under? Is there a medical director for those events?
That's a good question, Craig. And no, there is not a medical director for those events, generally speaking. Most of those are pre-hospital personnel that are acting as independent contractors and hired by the horse show.
Right. And others on the call can correct me if I'm wrong, but in the state of Texas, it gets a little fuzzy. But most other states, to operate as a pre-hospital provider, you are operating under somebody's protocols or somebody's physician authority. So who is that physician authority? Is that defaulting back to the local medical director who has no idea their personnel are doing that? Or are they actually potentially putting their license at risk when they operate in these events?
I think depending on the state, those are the two possibilities, yes. And I think that some of those providers may not be aware.
In Colorado, we default to the provider that the agency contracted with. So if agency XYZ They are covered underneath the medical director, our medical directorship, if they're covering a special event, rodeo, concert, etc.
Right, but it sounds like some of these events, they may not be actually tied to an agency. They may just be working theoretically completely on their own. I find that it's kind of an interesting quandary that happens, not just with these events, but
Yeah, no,
we see that with other events as well.
I totally agree, and I don't know, like, I know as a former paramedic that was something I always worried about, and then now as a medical director, I worry even more about who they actually answer to.
Right. From a medical legal perspective, it's a little bit concerning. Some of the folks that are working may not be currently working for any agency. This may be something that they've discovered as a potential way to make a living.
Yeah, Dr. Cooley, this is Dr. Winkler in San Antonio. And I'm sorry, I just totally cut in front of Dr. Wayne, who I love and respect, world fantastic trauma surgeon, if no one knows Marv. But I do want to answer the Texas question real quick. That you cannot, in Texas, it's delegated EMS medical practice. You cannot provide care of any kind as an EMT, advanced EMT, or paramedic. EMT can get a little tricky, but we'll definitely say paramedic or advanced EMT without a medical director signing off on you. And in addition to that, you have to have protocols, and especially if you're getting paid. So I'll give you some examples. In Texas right now, a big thing for medics to do is to start these IV hydration companies. I don't know if that's everywhere else too, but in Texas, you can't, paramedics operate under protocols and guidelines, and so it has to be prescriptive ahead of time. You can't say, oh, well, here's the 5 hangover choices for IV medicine. So while nurse pracs and PAs can do that, paramedics can't, which is a long-winded way to say, I'll just say in one of the very large metropolitan city in America that has one of the world's biggest rodeos, we had paramedics just operating as paramedics at that event without any medical direction, and they did not form a first responder organization. They definitely would be outside of the Department of Health's purview on what they could do. Each situation is different. Like, what if there are some special carve outs for like camps, like youth camps and so forth, specifically in Texas code. I can only speak for Texas. But events like this, I think they would definitely be outside the purview of their operational authority, Craig.
All right, I'm going to move ahead. Dr. Ritz, you had a question?
Yes, I had a question about C-spine. So in the EMS world, we've been moving more away from putting a C-collar on like every MVC victim, every person that falls, because the evidence doesn't necessarily support it. But I've witnessed that a lot of equestrian falls still have C-spine C-collars in place when they come in. Is there evidence behind that? Are there certain types of falls that we should be doing C-collars on, or is there are there recommendations in place for that we can use clinical clearance for these sorts of injuries?
I think that for the purposes of the USCF type competitions, I think that often the personnel that are applying the collars may not be aware of current protocols, but often those are applied based on the mechanism of injury. If it's an axial loading injury or the person is complaining of neck pain, I think that's generally when those are applied.
May I assist in helping answer some of these questions?
Please, Dr.
Sure.
Yeah. First of all, thank you, CJ. You're more than kind. I just got back from Atlanta, where I was at the sports medicine meeting sponsored by the National Football League and the National Association of Sports Trainers, all the key players. Many of these topics were covered. Nobody obviously covered rodeo. I used to live in Colorado. I also spent some time in Cheyenne, Wyoming. Yeah, drunk cowboys are a group unto themselves. But
One.
a couple of things that were being evolved and important at the meeting in Atlanta. One, you need to create an emergency action plan, and that plan either needs to be internally with a professional organization like the NFL, where the teams or even the college teams have doctors, paramedics, and EMS providers who are integrated with the local system. So, an example, when Damar Hamlin went down, the physician in charge there was a Cincinnati doctor, Bill Betts. The airway doctor was another Cincinnati doctor, but they had coordinated everything beforehand with the Buffalo Bills team. So this would be integration. All the EMS providers came in under the scope of practice of local EMS agencies. My suggestion is to all the rodeos, there's an independence and then there's a needed dependence. The needed dependence is you need to be dependent on local systems. If you get the local systems to provide the providers for you, they're covered by all the state laws and agreements that and CJ brings up exactly the issue. So we have a variety of events here, some of which are not quite as much fun. We have the Sumas Rodeo, which isn't as big, but they will actually contract with the local EMS agency to provide EMTs and if needed, paramedics on scene. We don't use backboards and colors in my county, and Washington State as a whole is moving away from that. That's a whole different topic and talk for another time. But I think the important message I would like to get across, and I really heard loud and clear this last weekend, and it wasn't just football, it was all sports, not rodeo, unfortunately. Integration of ideas with the local agencies and the action of what agency, that's rodeo or whatever. And two, pre-hospital plan, emergency action plan in writing, specific. I wouldn't want to see, the rodeo in Denver, and I used to see those because I did my surgical residency there 100 years ago. And I was up in Cheyenne for Cheyenne days and worked as a doc up there under contract. So I think if you freelance this, you will get the care of freelancers, and I don't think you want that care. By the way, thank you guys for putting this on. It's amazing.
Thank you.
And I think we'll have one more question from CJ asking Dr. Hollis and Dr. Miller about your coverage, your liability. Do you have MOUs? Do you use private insurance, or does your hospital cover this?
I'll let Dr. Hollis start.
Yeah, my role personally has been more observational and trying to help shows develop an emergency action plan and select providers that are covered by their local agencies and help to integrate more with the EMS, the local EMS response, and be better prepared in the event that something happens so that they can quickly go from incident to the patient getting to the appropriate place to be. So mine has been less of a hands-on and more of a consulting and trying to help the situation that needs to be moved along. Yeah.
Yeah, mine has always been under my medical liability insurance through my employer. And at some of these larger rodeos, they will contract with the larger health systems to come and provide care. That, of course, is not the case for smaller rodeos or high school rodeos, youth rodeos all the time, or more independent or state-run rodeos as well.
So please, everyone, join me in thanking Dr. Hollis and Dr. Miller for sharing their expertise and reflecting on this unique experience for us tonight. Do you have any other quick take-home points to share with the group? Or did we cover everything?
I would just like to say, once again, thank you very much for having us this evening. We greatly appreciate the opportunity to talk about this thing that's special and passionate for both of us. I would just say that that these are wonderful sports, wonderful people that do them. They need good care, and any assistance or interest that we can show them to help them have that good care is greatly appreciated, and will go a long way towards advancing medical care for these sports.
Right. And while we're presenting maybe the current situation, I think we'd really like to see things move along and modernize along with what Dr. Wayne was saying. There are new ways to do things for all sports, not just this sport. Just these sports need to be sort of encouraged to move in the right direction.
Well, once again, thank you everyone for attending tonight. You can see in the chat I put up for the next webinar we're having is going to be about EMTALA, which kind of had some questions here about, medical legal. So that kind of crosses over a little bit, but EMTALA and EMS, that will be our next webinar. So once again, I want to thank everyone, and everyone have a good night and stay safe. Thank you,
Thank you.
everyone.